How are you doing? No, how are you really doing? For years, mental health was a social taboo or a neglected issue in my country, Lebanon. You're exaggerating. Stop making excuses. Why are you always depressed? Are a few examples of the questions mental health patients face on a daily basis. As a clinical psychologist living in Beirut, I know there are many. The consequences of the pandemic, the civil unrest, the economic crisis, and the Beirut blast have adversely impacted the mental health of people across Lebanon, increasing the need for mental health support. The National Lifeline for Suicide Prevention reports 5 times more distress calls today than in 2019. These crises have been particularly harmful to children, with the recent study finding that 1/3 of children in Lebanon showed signs of at least one psychiatric disorder. In 2022, approximately 1 in 5 Lebanese aged between 15 and 24 reported that they have depression. In the past month, with the ongoing war, an estimated 1 million people have been displaced, 1/5 of the population. More than half of the displaced are children who are in grave danger of severe emotional distress. Unfortunately, 5% of the children in Lebanon seek professional mental health help. So, what can we do to support the mental health of a whole generation of children in Lebanon? First, we need to bring mental health services closer to the people and decentralize them. This can be achieved by establishing mental health support centers within schools, where children spend most of their days. Second, community awareness is key. We must launch nationwide campaigns that encourage open conversations about mental health to break the stigma. I have already started, and you can support my efforts by visiting my page and sharing my videos and stories. Third, we must use technology to overcome barriers. With online mental health resources, we can reach even remote areas, and I have already partnered with official institutions and NGOs for this purpose. This is how mobile apps like our National Step-by-Step was created. Finally, our government must prioritize investment in mental health and retain its professionals. But with the crisis, we need to advocate for increased international funding dedicated to mental health services, so help us be the voice of children in Lebanon. Treatment for mental health is a human right, and the children of Lebanon are in urgent need for this kind of support to safeguard their future. This is a call we cannot afford to ignore.